Hi, everyone. Thanks for joining today. My name is Paola Bello. I am the Director of Innovation here at Harvard Medical School Center for Primary Care. We're really excited to be partnering with MIT boot camps this summer to run the first healthcare entrepreneurship boot camp. It's going to be starting on August 12th, and we have a great lineup of entrepreneurs, MIT and Harvard faculty that are going to be participating. And leading up to that, we have a couple of webinars that we're sharing with all of you, featuring some great entrepreneurs in the healthcare industry. And I'm really excited today that we have Punit Soni, who is the CEO and founder of Robin. Robin is a voice-enabled digital assistant, and it helps to lift the burden of medical documentation for physicians, and it allows them to focus on what they truly love to do, which is taking care of patients. Punit, thank you for joining us today.
Thank you for having me.
Great. So before, or actually just to get us started, you've done a lot in your career. You were Chief Product Officer of FlipKart. You spent time at both Google and Motorola creating some really great products. And now you're in healthcare. And I'd love to have you share with the audience a little bit about, more about your background and what got you interested in healthcare.
Sure. Absolutely. Thank you, Paola, for having me here. I think before we start, Paola, can you give me a sense of the audience so I can try to make sure my answer is relevant to them?
That's a really good question. Looks like we have about 100 people signed in here. They're actually from all over the globe. So I think we have an international crowd joining in today. And I actually thank you for saying that, because I do want to encourage the audience to, in the chat window on your right-hand side of the screen, to put in some questions that you would like for Punit to answer today. I'll be kicking us off, but definitely share your questions with us. And the webinar is going to run till about 1:15.
Okay, great. Sounds good. So let me tell you my background. I started my career in electronic design automation. So this is like, completely different area from where healthcare is. I did a little bit of venture capital in the middle, and then ended up in Google, where I was in the search team. These are early days of Google. And once, I think a couple of years in, mobile had just started to take off. I really wanted to be a part of the mobile wave. And so ended up actually joining the mobile team of Google. One thing led to the other, ended up becoming the mobile apps lead. And so my team built early versions of everything that you have on your phone, from Google Gmail, Docs, Chat, YouTube, Calendar, etc. Then did a little bit of socials, or Google Plus Mobile, Google Plus Games, Google Plus Platform, login, etc. And so I always joke with people that for all the success that we saw in mobile, it became a billion-dollar business. We saw a lot of failure in social, and so that actually kind of evened out. And there are interesting lessons of product development and how we approached both of those areas. And then we acquired Motorola, and I was asked to go and run a software product for Motorola. And so spent the next 3 years of my career restructuring a 30,000 people company into a 3,000 people company, taking 43 phones that they had built and moving that into 3 phones, and building 3 new phones: Moto X, Moto G, and Moto E. And G is amazing and very relevant, because I think the Brazilians and the Indians in the crowd will know that it's probably one of the most popular and first low-cost Android phones ever built. Then Xiaomi, Huawei, Lenovo, everything popped up. And X was the first always-on listening phone. It was years ahead of its time. Alexa was not even a blip in anybody's eye at that point of time. Siri hadn't really launched on iPhone yet. And we had a phone where you could say, okay, Moto X, navigate me to Starbucks, and it would know what to do. And so most of my career has been in consumer and mobile, and working directly with users. The last thing I did before I started this company was I was the Chief Product Officer of a company called FlipKart, which is an Indian e-commerce company that's bigger than Amazon in India and a very strong Amazon competitor. And so I kind of joke with people that I started my career in enterprise software, did search, then did mobile apps, then did social, then did hardware, then did e-commerce. Now it's only logical that I should do healthcare, uh, and and so that's kind of my story. I think the second part of your question was why did I decide to get into healthcare? um, I think you, Paola, were a little bit of a part of that journey because I came over to Harvard a few times and met you as a part of my diligence process on the field of healthcare, and a couple of different things. First, I wanted to do something where there was a clear go-to-market. Second, I wanted to do something, and that's important because startups without go-to-market, much more than if you were in a large company, just absolutely have no shot at succeeding. Um, Second, I wanted to do something that would use my skills. I think no matter what problem I would attack it from a consumer perspective. And so therefore, being able to think about how the user felt, regardless of whether that user is a doctor or that user is a consumer who's using a phone, is the same thing and same kind of thought process that's required. And third, I wanted to do something that when I go home every day, I would feel like it's adding value to society. And no matter which side of the political aisle you are out here in the US these days, nobody can argue that healthcare isn't the top one or two problems in the country. It's 20% of US GDP. It's 5 to 7% of every country in the world's GDP. It is consistent, perennial. You will need access to it throughout your life, and it is absolutely incomprehensibly broken. And so there is a shot, a small but very important shot at building a company on the scale of a Google or Amazon or Facebook or a Netflix, but in healthcare. Because if you look around you, what's a great, huge, big company of that size and scale that's emerged from healthcare? Um, I think the answer is still TBD. And so that's kind of why we're all on this journey.
That's great. And speaking of the large companies, and I do want to go back in a minute and talk about what Robin is doing, but it's a great segue. You talked about the big companies like Amazon and Google, and you do see them getting more into healthcare right now. What's your take on that? Do you think it's a positive? How do you think it's going to impact healthcare as a whole, as well as small startups like yourself that are out there, trying to make a difference?
It's always, I think it's actually super exciting that Google and Microsoft just recently announced an initiative in this space. Google announced an initiative in this space, and its brain team's been working on it for some time. Apple has started its own healthcare initiative, starting with employees, and then it'll grow further. Amazon obviously announced with Berkshire Hathaway. It is interesting, isn't it, that all the major platform companies in the world are now coming into healthcare with a lot of seriousness. I think it's exciting. I think it actually alludes to the fact that a lot of them and us believe that the time for technology to really make a difference in healthcare is probably here. I think it's actually very good for startups because platform companies typically are not able to build incredibly deep vertical experiences that well. And so startups can actually fill a very important hole in that ecosystem. And whether some of these startups that will pop out will get acquired by these companies, or some of them will become partners, or there is a very small chance, but some of them will actually become as big as these companies. In any of these situations, it's actually a very interesting and important strategic move that all of them have moved in. The worst thing you want as a startup working in a sector is to see that nobody really cares. You think you're actually in this space, you want to make a difference. You look around, there's very little competition. You look around, there's no large platform companies interested in the space. You can argue that there is a chance that you're so smart and such a big genius that you found something that nobody else knew. But more often than not, what that really means is the time may not have come for this disruption to have happened. And so from my perspective, it's only logical that these large companies would be here. And it's actually a very validating and important aspect of of being in this space.
Exactly. I think if it's absolutely validating to see that they also recognize what you first said in your starting remarks about how important it is to be in healthcare today, and certainly a lot of problems, which means a lot of opportunities for startups and big companies. So Punit, why don't we dive a little bit into Robin and give us a little, as much information as you can give us about the product that you're designing right now, and what's your company's vision looking a little bit further out into the future and how you want to impact healthcare?
Sure. So I think I'm a very firm believer in this equation. The equation that I was trying to solve was, what's a powerful constituency that has a huge burnout problem, the solution of which aligns with a important incoming trend, technology trend. One way to look at this equation is, if you look at enterprise software, um, in 1990s, everybody was doing, like using custom SAP software. And if you were an enterprise startup and you went and tried to sell them your software, they would say, I have a $1 billion contract with SAP that goes over 10 years. There's no reason for me to try your software. Mark Benioff's genius was, he said, what's a powerful constituency? Salespeople. What is a big burnout issue they're facing? Lack of CRM. What is a big technology trend that can help solve this? The move from on-prem software to cloud software. And, he basically built cloud CRM. Everybody adopted it hand over fist. Lots of data flows through the system. You can use that to build ERP systems. You can use Force.com app infrastructure. And now he's got basically the most relevant and interesting enterprise software company in the world. So it's an example of how you can solve this equation and go into intensely monopolistic, yet custom software oriented markets and have a beachhead. And so if you look at healthcare software, a lot of health systems have custom software from Epic, Cerner, and other places. If you actually have ideas on how to streamline and make things better, most of the conversation will be around, well, I have a $1 billion contract over 10 years with these guys. Why would I actually use your system? More importantly, how would I even fit this in? And so to even have space to breathe as a startup, you need to start from a point of view of, what is a powerful constituency? Doctors. They're an incredibly powerful constituency. Why are they burning out? Yes, they're burning out. Why are they burning out? They're burning out because of regulatory burden and billing and all the documentation they have to do, where they spend 2 to 3 hours a day just kind of typing stuff. Okay, is there a technology trend that can help actually solve this burnout issue? Yeah, the commoditization of voice and machine learning can allow you to be in a world where doctors and patients can interact, and most of the administrative work can be over time taken care of. And so that's the thesis and the entry point of a company like Robin. I am not building a medical transcription company. I am starting by building a medical documentation solution. If I actually build something that will be useful for the doctors, then I'll become the front end for the doctors. A lot of data will flow through the system, and then I can use it to chip away and solve other problems across the health stack. The vision of our company is to rethink healthcare technology and make it almost invisible yet assistive, contextual yet not something that's in your face where you're looking at boxy UIs and clicking things, so that when doctors and other healthcare professionals walk around doing their job, it's available to them on their fingertips, but it's not something that they have to kind of engage with at the expense of engaging with the patient. And if we can do that, then I believe truly that this software, healthcare technology software, would have come into its it would have become current. Because if you look at mobile game developers, you look at software developers in general, you look at e-commerce, you look at all sorts of other places, you see that tech and software and the way the UI looks and what happens is so far ahead from what is happening in healthcare. So that's generally the theme and the vision around which the company is built. Of course, we're only 11 months old at this point of time, so there's a long, long way for us to go to actually get there, but that's the vision.
That's great. So we actually have quite a few questions coming in, but before that, I do want to sneak in one more from my end. And Punit, as you know, healthcare, I think, is unique because when you're designing a product, you have to consider not only the paying customer, but the using, who's going to be using the product. In your case, your product is directly impacting the doctor, but it's also impacting the patients and the entire team. And so I'm curious in your product development cycle, how you've thought about and considered all the stakeholders involved in healthcare.
So the question was, how do you think about go-to-market, in a sense, right?
Yes, correct. Especially when you're in an industry where you have many stakeholders, both the end user and then the paying customer as well.
Sure. Every time somebody says, and when we were starting the company, a lot of very wise people said, this is crazy, don't do healthcare. It's pretty hard. Sales cycles are awful. The people who actually benefit and the people who actually pay are different people. It is incredibly hard. It'll take 18 to 24 months to get any contract done. And most startups will burn out of money because of that, which is actually a very valid and in some ways a very valid feedback for anybody trying to actually do this. There are legitimate reasons why the cycles are so long, but it's also a little bit of a criticism of how the healthcare stack has been put together and the personalities and the people that are involved in actually making these decisions across the board. My perspective on it is pretty straightforward. Like anything in life, if the problem is acute enough, then the sales cycles are short enough. If you have to convince a lot of people to actually look at your software and take a shot at it and maybe give you a shot and give you a pilot, etc., then what really means typically is the problem's just not painful enough. And so you just have to find something that's so painful that everybody wants to take a shot at it. And then it doesn't mean things become easy, but it's definitely easier than trying to do, I don't know, care coordination software for people where there are 50 startups trying to do the exact same thing, and there's really no specific way to integrate with the existing health stacks. It's an example of how you would think about it. So in our case, this is why we said we will look for something that actually is hopefully the top 1 or 2 problems in health systems. No matter which health system and what size I talk to, this issue of clinical documentation is the top 3 issues in every health system. And if it is really a top 3 issue, then every CMIO, every CHIO, every CMO, every C-suite person who is responsible for doctor experience, etc., is thinking about it. And if they're thinking about it, then they will actually pay attention to any company that can actually walk in with an interesting idea and an interesting take on it. And so first and foremost, go back to principles and first principles, and basically make sure that the problem you're solving is legitimately, and not just in your head, but in a legitimately proven and validated by people in the industry to be the top 3 problem that they're dealing with. If it is not the top 3 problem they're dealing with and you still want to do it, you can do it, you're passionate about, but remember that it's going to be a very long and arduous battle to try to get attention. So that's one that you have to do. Once you actually have done that and you feel like you have a problem that's in the top 2 or 3, then you have to very objectively as an entrepreneur sit down and look at your skill set and things you bring to the table and what you're missing. So I'll give you an example. I'm a consumer guy. I don't have the ability to, I haven't done any enterprise SaaS before this. I have 0 healthcare experience. So I knew I needed healthcare go-to-market. I needed the ability to get people who actually know how to build super secure, HIPAA compliant level SaaS software. I needed to make sure that I had people around me who understood healthcare policy and regulatory burden. And then with, A, my network, B, my consumer skills, I could actually pull in the rest of the team. And so, I chose my investors based on that. I chose my co-founder based on that. My co-founder ran infrastructure at Salesforce, which means he actually knows enterprise SaaS and knows how to scale enterprise SaaS on top of custom infrastructure, many times over. I chose the initial members of my team. Most of the people in my team who do functional roles, especially product and sales, are actually doctors. I did not hire a chief medical officer. I actually hired a head of product who was a doctor. I hired a head of sales and BD who was a doctor. And so I chose the team to complement my deficiencies and the things that I actually needed to do. So let me kind of rewind. First, make sure that the pain point is top three. Second, have an objective point of view on what you're missing in being able to be a credible team that can attack that pain point. Fill that in using either a board, advisors, or co-founder or early hires. Once you have that, I trust me, every room that we walk into and we say, here's the people we have put together, here's basically how we're going to go about doing this, and here's basically the problem we are solving, people pay attention. It's it's not easy, but it's definitely way easier than going in, deer in headlights with none of these things in place and saying, I want to build something and give me a shot. And so I don't know if it answered your question, but that's how I would go about it.
No, fantastic. And you actually answered a couple of the other questions that I saw popping up. Going back to the pilots for a second, I know you and I have had conversations about approaching large health systems versus approaching a smaller healthcare system or a group of clinics. And I'm curious what you have found in your experience in trying to pilot your product. What have you found to be most useful, and what advice could you give to a smaller startup who's sort of contemplating the same issues?
Yeah, I mean, this is a little bit of you have to create momentum. So if you can identify a pain point that's really up there, then if you can build a very powerful team, then people pay attention. And when people pay attention, it becomes easier to get early pilots going. So first, just absolutely make sure you don't forget these basic tenets, because without them, you can't start from the middle. You have to start from your foundation. You have to make sure that these things are right. Now, let's say these things are right, all things being held true. I think there are parallel paths to pilots and sales and go to market. It is true that a company is not going to scale to a point where it has tens of millions of dollars of revenue unless it actually had one or two large systems working with it. But it is also true that it's possible to get $1 million of revenue and early pilots by start just attacking small and medium, partnerships, health practices across the country. And so the way we attack it is both ways. We have large health systems that we work with. We know that their processes and their setup is going to be such that it's going to take, let's say, 6 months to a year minimum. It could be 18 months to even 2 years for all you know, for these things to pan out. So we'll do that. We'll have those conversations. We will run through the process. We'll build our relationships. It's a long-term game. I'm in this for a decade, maybe more. It's fine. Happy to engage and kick that off. And then somewhere around year 2, things will start panning out, et cetera, et cetera. So we'll have to do that. But in parallel, we have a very strong go-to-market thesis around going after small and medium health practices, 1 to 100 doc setups, easier to get to. You have to work through a few of them to find the ones who really deeply care. But if the problem's top 3, it's the same problem for them also, so they will care. The contracting process is like a week. It's just so easy. And then, you have early pilots going with some of these guys. You have some other conversations going with the large guys in parallel. And it's a really, really comfortable position to be in. So it's not either or. But if you're thinking you're going to go to like a large health system exclusively and try to do this, it's really painful. You will be spending a lot of time going through a process that may perhaps even distract you from the core work you have to do, which is build the core product initially. And so I would strongly recommend building relationships with large systems and continuing that conversation, but focusing on small and medium setups to actually give you early pilots and early validation for your product.
Excellent. I do want to mention too, I've seen a couple of people asking to repeat certain points. We are recording this webinar, so you can go back afterwards and listen to Punit's talking points as well. So there's a couple of questions that are popping up around pain points, and one in particular about, if, especially Punit, you were not in healthcare, you were new to healthcare. How did you go about gaining access to the right people to help identify those pain points?
Yeah, I mean, unfortunately, I'm going to give you an answer that's not going to feel very satisfying to people. The best answers are, I was such a hardworking person. I was out there on the streets and I somehow found Paula and convinced her, and then she found somebody else who was even more, up sea level somewhere, and they convinced them, and then somehow I networked my way from the ground up to actually get to these people. Unfortunately, some part of it is really true, but some part of it is not true. I think there is an existing network that I had, because of Google, because of the work I was doing, because of the people I have known in venture capital and some of the investing I've done in the past, that it was not very complicated to pull favors from people and say, hey, I need to spend a few months in this health system. I need to spend a few days shadowing this doctor. I want to do that. And then be able to kind of, get in there and access the environment. You're not going to be able to access people who will sit down and explain these pain points. I think Prasol is asking this question. You will potentially, if you network with diligence and sincerity, will be able to get to a place where you'll be able to access the environment in which those pain points sit. It's your job as an entrepreneur to identify the pain points. You will identify things that perhaps others wouldn't have identified. And then you would actually use that to figure out your thesis, your core thesis. And so in our case, I was lucky enough to know people who could actually get me into these large health systems, so I could just access it. I wasn't sitting in front of CMOs and CIOs just talking shop. I was actually sitting with doctors, walking next to them to see what they were doing, sitting in break rooms with LPNs and nurses who would more often than not just shout at me for the crazy ideas I would come up with. And then in the process of doing all of that, I found this thesis. And once you have a thesis and you have a thoughtful point of view on a thesis, you'll be surprised at the number of people who will crawl out of the woodwork and who will want to actually help you and assist you, because they realize you aren't some person who just randomly showed up. You're actually a thoughtful person who has a thoughtful point of view on these things. So, so my advice is there's going to be a lot of, this is the hustle of entrepreneurship. Get on the ground floor, start networking to try to get access to the areas where these pain points exist. And then if you are thoughtful and you are credible and you have a point of view that's fresh, you will see a lot of people sit down with you and actually help you. But there is no equation here, that just anybody without doing that kind of work can solve. You just have to go through it.
Fantastic. And I would also add, if you don't have, a strong network, you can start with your own doctor and ask if they would be willing to talk to you, or, potentially friends have, a relative who's a doctor. Start thinking about your internal network, and you'd be surprised that you might start to find access where you can't find it. But I think that's it's a great answer, Punit. Thank you. So let's switch over a little bit more on the tech side. I have a question here. I'm going to actually combine two questions here. Why is machine learning AI the tool uniquely poised to impact healthcare? And I want to tack on to that. If you have experience, you mentioned a little bit about bringing on the right people that could handle HIPAA and all the regulatory, and how has that impacted your product development? Has the regulatory in space, has that been a hurdle, or how have you managed that?
Sure. So two different questions. First question was around artificial intelligence and machine learning. I almost joke with people that at this point, you want to build anything in life, you should just say it's an artificial intelligence oriented social network that's going to solve some location oriented shopping issues. And then people will be actually happy to give you money. We're in the world where AI and ML is probably the most maligned, most misunderstood technology that everybody thinks is going to be the holy grail to solve all critical problems. First, machine learning algorithms are actually more or less a commodity. Okay, you can just go to TensorFlow, you can go to a bunch of other platform companies and have access to machine learning models. The holy grail of artificial intelligence and machine learning is not the actual algorithms that actually learn this stuff. It's actually data. And data is the one thing that most startups have very little of. To be able to have unbelievably large amounts of data, you have to have a product that's widely adopted that people like. And when they use it, there's a lot of data going through it. And if you are thoughtful enough to build your infrastructure in a way that's structured, then you can use that data to actually run these through these machine learning models. And then you can come up with insights that can make your product self-learning and interesting. And so first, if you are thinking of anything related to ML and AI, then what you're really thinking about is how do I get data? You're not thinking about machine learning, you're actually thinking about how to create data. So that's an important nuance that we should be very aware of. Second, if there is a sector that has 20% of the country's GDP, where unbelievably huge amounts of data is created on a daily basis, to be honest, a little bit of garbage in and garbage out, because it's sent into these absolutely overstructured setups where you can really not access them very well, but there's a potential to actually create structure out of them. The amount of data that's created is probably larger than almost any sector in the in industry. It is, by just continuing the argument, pretty straightforward to assume that then these commodity machine learning algorithms can make a huge impact on that sector. So, why is AI and ML poised to disrupt healthcare? It's poised to disrupt healthcare because AI and ML exist now. Those algorithms are there, and the data has always been there. It has probably never been there in the right format, but now slowly and steadily it's getting to be there in the right format. So if you put those two things together and you can club it with a use case that actually really thoughtful and interesting that people actually want to use the product for, you have a beginning of this sort of disruption. So that's the key reason why I think AI and ML is going to have a huge impact on healthcare. I'll pause. Paula, does that answer your question?
Yes, it does. That's great. And then
Okay.
the second part was about regulations
Yes.
and how you're dealing with that.
Yes. So I don't look at it as a hurdle. It is important. You can see what's going on in social networking right now. If you don't thoughtfully, if you are not thoughtful about people's data, if you're not thoughtful about who can get access to the data, how they can get access to it, and how you can actually put together a plan to keep people safe, then you're going to end up in the world of Facebook, and all the complications that come with it. Healthcare data is, by many arguments, even like 100x more sensitive to some of the data, though I suspect social networking data is pretty sensitive too. So, people's lives depend on this stuff, people's choices on how they live, what kind of stuff they do, who they work with, etc., depend on this stuff. You have to be very thoughtful about what you do with this data. So I have a lot of respect for compliance and regulatory burden that's been put in. I wouldn't call it a burden, actually. I would call it a framework that's been put in. You need that. If you don't have that, then there's a reasonable chance that unregulated startups and companies in a horde to try to figure out how to build a good solution might make mistakes along the way. So I am happy for the framework. I embrace it wholeheartedly, and I have the right people in the team who actually know how to execute and implement it. Now, there's a second part to that, which is this something that will slow us down or speed us up? I think the answer, like most things in life, is it depends. It will slow us down a little bit because we have to be very thoughtful about how we do this and how we put together a framework for our infrastructure. But once we actually do it, it will speed us up dramatically, because now we'll be able to absorb all sorts of interesting data, and do all sorts of interesting partnerships without worrying about what's going on with the data that we have created there. And so the summary is, you should respect it. You should care deeply about it. You should not think of it as as something that's shoved on you to slow you down. You should look at it as something that actually keeps people safe And in the world we are in, and the entities that are actually, always trying to get data from you, whether they're countries or companies or rogue hackers, you want to be in a place where you actually are very thoughtful about people's data. And then if you can actually put it together, it's also an incredible moat for the people who actually know how to deal with data with the right security and privacy. They actually can build a product that others can't replicate that easily. They're used more. And so in many ways, it's also a competitive mode.
That's great. We have another question here from the audience. It says, as you pointed out, your product might generate, hopefully, a lot of structured data. Any plans to involve pharma companies early on as a stakeholder? And they mentioned Flatiron's acquisition by Roche as a great example of the model.
Yeah, I mean, the short answer is we don't know. We're month 11. Right now, all I care about is my user, and if I can make that user happy. I have to make sure that doctors love me so much that they actually want to have me in the exam room with them, helping out as they actually look at the patient. I am not spending too much time trying to figure out what happens after that. So philosophically, every pixel in this company is in the service of the doctor. If it turns out that there is a go-to-market that actually continues to keep us beneficial to the doctor and medical community, is a way for us to fund certain other things in the company, then we will consider it. But it's too premature at this point in time to think about alternate ways of monetization. We should focus on the doctor. If we make them happy, we'll have a successful company.
That's great. And so it's a little bit, this question is maybe expanding that on a little bit in terms of like your, focusing on the physician, your customer. This question says, so is Robin's business model a B2C, since you mentioned your product service front end customers are the physicians? If this is the case, who are the B? Is it hospitals, clinics, or is it Epic, Cerner, etc.?
Yeah, I mean, I look at this B2B, B2C, C2C, B2, B2C, and all these random, acronyms as basically a legacy of 1990s and early 2000s. The company is basically building a product whose job is to make sure that doctor, clinicians, and healthcare professionals can do what they love to do, which is take care of the patients. So our end user is squarely a healthcare professional. One, to be able to sell to that healthcare professional in small and medium entities, we actually can sell directly to them. In large entities, we have to sell to administrators who are CIOs and CMIOs. When we sell to CMOs and CIOs, CMIOs and CHOs and all the various variations of that, we end up actually being in a place where we have to work through their existing stack, existing procurement process and all of that stuff. And so therefore, you could argue that that's actually a little bit more B2B-ish, with the actual consumer being slightly different. For the others, the small and medium business setups, it's a direct-to-consumer kind of a sale. So we sell who we need to sell to actually make sure that our doctors have access to the product, whether it is going to be direct to business sale, whether it's direct to consumer sale. We actually treat it not too differently right now. There will be enterprise sales to be done, which means we'll have to put enterprise sales infrastructure to actually do that. But ultimately, it's a SaaS product. The goal is you can get up there, you can log into our site, you can basically create an account, you can then go ahead and actually start using the product. The sale part of it will happen behind the scenes as a contract directly with the doctor or with an administrator, depending on who we actually sell to.
Excellent. And jumping back to the product design piece, it seemed to me, and I think I've maybe been in healthcare for one too many years now, that you moved very quickly, which is a great thing. From the sort of first line of code you wrote till you took your MVP to a doctor's office. Can you talk a little bit about that? I know entrepreneurs struggle a lot, especially the first time entrepreneurs, of how what does your MVP look like? How perfect do you have to make it, or how imperfect does it have to be before you get into in front of your end user?
Yeah, absolutely. I mean, I actually define this as not MVP, but as a MDP. So minimum delightable product. The first thing you need to do is you need to find the absolute minimum product that will actually delight the doctor in some way, or your user in some way. One thing of their life has to just get better as soon as they start using the product, even if 10 other things are still work in progress. If you don't have that hook, it's just hard to convince really busy people, let alone doctors, but in general, busy users to try your product. In many ways, it's a consumer mantra. That's how you think about it when you actually build a consumer product, but it actually works effectively in these setups too. We moved pretty quickly. I mean, our timelines were, you know, we were discussing which area we wanted to be in somewhere around the end of 2016. 2017 till March, we were trying to just do go to market diligence to see, is there a budget, who will buy, who do we sell to, etc. April, we raised money. We were 2 people then, now we are an 18 people team. We basically built the first version of product by we started coding in April, and by September we had a very early rudimentary version. I think in October we deployed it in the first pilot, and then from there on it kept going. So a couple of lessons that I think are useful, if it's useful to you guys given your context. One, build the barest minimum product that actually will have at least some element of delight and value to your user. And that, when it gets to it, is something that you need to be able to deploy and should be able to deploy quickly. So that's one. Second, be very aggressive about finding a doctor, to small practice, whatever you can get access to, who will basically try your product out. If your number one point of delight is there, hopefully when they try it, they will actually not throw it out of the window. They'll actually continue wanting to use it. And so I don't think you should overproduce this. We were May, June, July, August, September, so 4 or 5 months of work, and then we were in the doctor's office. The other part of this is, if the user's not using it and giving you real-time feedback, you'll end up building something that you think you want to build, which actually is not the job. The job here is to actually build what the user likes and works for the user. So you have to get user feedback. So I would say that has to be done. And once that's done, then the launch and iterate cycle moves fast. You can just keep going, build, get feedback, think about the feedback, rebuild, iterate, keep going. And then your product only gets more interesting and more valuable. So other people will jump in, they want to pilot it. And so now you have this beautiful virtuous cycle and momentum that you've created. So my top level advice on this is this is classical product management, by the way, guys. I mean, you have to identify your user, build the minimum delightable product, get it in there no matter with who to start, make sure you get feedback and iterate very, very quickly. And then as you iterate, you will automatically see go to market iterating too, because if your product gets better than what it was day one, and somebody was using it day one, then there'll be more people who will be interested in using it day two.
It's great. And I would imagine as part of this process, you probably had some setbacks, little bit of failure, and curious to hear from your personal perspective, how do you deal with that as an entrepreneur, and pushing forward and knowing when to take the feedback, or when to stick to something that you feel is the right direction to go? I think that doing a startup is actually excruciatingly hard. And the biggest failure point in a startup is actually in your own head. You as an entrepreneur can walk out and think, oh my God, you can just think yourself into believing your vision or completely disbelieving your vision. And then psychologically you're down and out. I actually think the hardest part of startup is actually maintaining emotional state. And most people fail and succeed because of their ability or inability to maintain emotional state. It's actually very objective also. To be very clear, maintaining emotional state also means being unemotional to some extent about your product thesis, because you could be wrong. And I see for every 10 entrepreneurs I meet, at least 8 of them are like, this is it. This makes perfect sense. And no matter what feedback is passed at them, they just refuse to believe it.
The bullheadedness is needed because you have a vision and you want to get it done, but it has to be objective. A couple of interesting ways you can manage emotional state and these kind of things that you were talking about. One, surround yourself with people who care for you, family, friends. Share your vision and thoughts with them and make sure that they are part of the journey. Number two, be very thoughtful about identifying co-founders and early team members. They are people who have bought into your vision. They are people who will be able to correct you and call you out when you make mistakes. So you need to make sure you find people who actually are not in awe of you. They're people who actually want to work with you as peers. So I think that's very important. Third, and this is a classical rule to use when you're actually doing this, at regular intervals, ask yourself, if you had $1 million, would you invest in your company? Cash. And if you actually can objectively say, yes, if I had $1 million, I'd put it into this company, my personal money, then you're on the right track. If you don't think you can put $1 million of your own cash into the company, there's no reason anybody else is going to buy your product, put their careers on stake to join you, or actually raise capital through other people. So there's some ways you can consider to actually try to clarify your mind and make sure that you're thinking about the right thing.
That's great. I love that tip about the $1 million. That's a really good one. So we actually have, we haven't gotten into funding very much, but there's an interesting question here from Luther. Healthcare requires large amounts of funding. How can college students execute a helpful idea and find ways to receive funding?
Yeah, I mean, you look, in many ways, the path of Robin is different from a path of a college student because, of course, because we're all kind of like slightly more experienced and have been dealing with this industry. But if I was starting this and I was basically out of college, first of all, I did that when I was out of college. I had actually started an enterprise software company. You would actually want to follow a slightly different path. You should actually consider some of these incubators and accelerators, especially the high value ones. So YC is a good one. I have invested in a bunch of YC companies personally also. They have a very good model of how they actually, vet out people and decide these are the kind of people that they want to work with. And then they give them a lot of infrastructure to actually do that. YC companies get a lot of attention too. And so then from there on, you have a virtuous cycle that can be created. So if I was doing it, I would actually probably look at something like YC. I'm not going to, there are others, there's a bunch of others, 500 startups and various, I don't know the pros and cons of these ones necessarily, but I do know that there is 2 or 3 of them that are really high quality and it's worth applying to and getting in. And then you get access to basically really world-class entrepreneurs and venture capitalists and professionals, and that you can use to actually give a leg up. So I think that's actually something that you should really, really think about. It's one. Second, as a college student, you have some special skills and you should think about that. Most people actually would be very happy to sit with you and spend time kind of giving you their point of view on the problem you're solving. You can use that to really network your way through and get basically early thesis, go to market, and all of the things that you want to talk about. It's actually easier to do that than somebody in the middle of their career because they're like, you better know what you're talking about already. With a very young person getting out, you have access in ways that you can't even imagine sometimes. So I would say those are some of the things to think about. Typical way to get to funding, in my opinion, college student or not, is first and foremost, have a thesis, a problem statement that you think needs to be solved and is the top 3 pain points in the industry you are in. First. Second, you have a go-to-market thesis. The go-to-market thesis can be backed up by finding advisors who will actually give you your early pilots or advisors who will actually get you some early sales. So I intend to sell to this person. This particular budget is what we want to attack. That's the level of detail you need to know. Is there a line item in the budget of that particular entity for your problem? If the budget exists, who are the people who actually sell that? You need to know that too. then you need to have some way to find access to those people, or at least have one or two people who can at least help with that stuff. I would put that in your advisory board, regular board, or some way get them associated to your company. So now you have a thesis, you have a problem statement with a solution, you have some sense of go-to-market, you have all of these together. Make sure that if you're a technologist, that you get a business person who can help you. And if you're a business person, get a technologist who can actually build this product. Don't go try to raise money without having an engineering leader with you. You know, it just never can pan out very well. And then when you have all of these above, you can decide whether I actually want to apply for YC with all the information I have, or I want to actually go the direct seed capital angel route. But very few people have thoughtfully, so you'll be surprised, for 100 startups that pop up, only 5 or 6 thoughtfully put all of these things together in a very objective and textbook-like manner and come in. And those who do, they don't have that much difficulty raising money.
Thanks, Punit. That was a good crash course in fundraising. So we're coming to the end, but I'll ask you one last question. What has surprised you most about the healthcare industry? And as a rookie to the healthcare industry, how has that benefited you the most?
Interesting question. What has surprised me is that regardless of the incessant drumbeat of painful sales cycles, bureaucracy, and all of the intervening things that you have to deal with to actually wedge into the healthcare, there's a lot of awesome, thoughtful, passionate people in these entities who actually deeply care about the state of healthcare in general and want to take a stab at fixing it. So if you can, with utmost sincerity and thoughtfulness, get in there and spend time with people, you will recognize and realize that there are a lot of amazing people. Even in setups where it feels like it's going to be very red tape-ish and bureaucratic, there's a lot of very thoughtful and exciting people who actually want to solve these problems. And they have different sets of capabilities and different levers of power in their hand, but they're happy to collaborate and work with. So what has surprised me has been basically just the amazing, I almost call it love and affection you can get if you actually try to solve a problem that matters to people and can help with healthcare. There's a lot of people in there, in the grind, who actually are in there for their entire careers, basically trying to make healthcare a better place and serve their patients better. How it's been, obviously, once you understand that insight and have some access to that, it's powerful. The number of allies you can create, and let me be clear, if you intend to do a healthcare startup, you have to create allies. Way more than if you're going to do a mobile gaming startup, mobile analytics startup, e-commerce, etc., whatever. Everywhere you need some network, but in healthcare, you need a lot of powerful and interesting allies. And so it has been useful because once you actually identify and look at people from empathy and understanding that they are operating in the state they are in, you will find them actually reaching out to you in more ways that you can imagine and helping you. And so our startup, for whatever little momentum it has got, it's got it because of people like you, Paola, and like your organization, and like many others like you across the country, who have kind of said, we'll help you. We'll help you. And, the only return for all of these people, many of these people, is that maybe an interesting, good startup will come about that will actually solve the problems that they care about. That's very powerful and something that we should tap into more and more.
Thank you, Punit. Thank you so much for participating today. I've really enjoyed watching your company grow from just an idea that you were pursuing to what it is today, and I look forward to seeing it continue to grow. I want to thank the audience for participating. Sorry that we weren't able to get to all of your questions, but as you know, Punit gave some really great advice and some insight that I think covered most of what you wanted to hear today. So I hope that I get to meet some of you at the boot camp this August, and thank you again for participating. Thank you, Punit, and we'll see you at the next webinar.